Get it? Slip it? Cuff it? Check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
Good morning, everyone. Happy Black History Month and Happy Heart Month. I hope that you all are finding ways to celebrate these great occasions. I'm Sherry Wells, Executive Director of the American Heart Association of New Mexico, and I'm so excited and grateful that you are joining us for today's conversation focused on health equity. The American Heart Association believes every person deserves the opportunity for a full, healthy life. But unfortunately, not everyone has this opportunity due to factors beyond their control. The American Heart Association set a bold goal that by 2024, we will advance cardiovascular health for all, including in identifying and removing barriers to healthcare access and quality. We believe that everyone deserves an optimal and just opportunity to be healthy, giving special attention to the needs of those at greatest risk of poor health. We also want to ensure that no one is disadvantaged from achieving their potential because of social position or any other socially defined circumstance. I'm really excited about today's conversation. It brings together local leaders in the health equity space to chip away at what a huge topic this is. I want to thank U.S. Eagle Federal Credit Union for sponsoring this opportunity, as well as our panelists and moderator who have taken time from their busy schedules to discuss a topic so critical to the American Heart Association and our goal. To get us started, I'm now pleased to turn it over to moderator Maggie Tannen. Maggie is the VP of Human Resources and Learning and Development at U.S. Eagle Federal Credit Union, with over 20 years of experience in banking and human resources. Maggie brings together proven expertise at designing inclusive organizational cultures, systems, and programs that enable business leaders to harness the power of diverse talent, thoughts, backgrounds, and experiences. Maggie?
Thank you, Sherry. U.S. Eagle's honored to sponsor today's conversation about health equity, and I'm proud to represent U.S. Eagle on today's conversation. Before we get started, I'd like to introduce you to our amazing President and CEO, Marcia Majors. Marcia, take it away.
Thank you, Maggie, and good morning, everyone. I'm delighted to be part of the conversation today. And I want to share that here at U.S. Eagle, we are very passionate about achieving the highest level of health and well-being in our organization. It's our belief that as a community provider, that when your staff is healthy, successful, and thriving, that the community as a whole wins. We believe that this tailored to our goals, along with our culture, it very much serves as a competitive advantage for our organization. And really at the end of the day, it serves as a productivity booster. So we're very, very proud to be part of the conversation. And I'm sure that from today's conversation, we will all come away with insights, tips, and hopefully inspiration to achieve personal and professional wellness goals. I want to thank you for the opportunity for U.S. Eagle to participate in such a very important topic, and we look forward to being a part of the ongoing discussion. So with that, thank you all, and back to you, Maggie.
Thank you, Marcia. Appreciate that. As I said, I'm excited about this conversation, and we have some exceptional community leaders joining us today. And Sherry mentioned this is a broad topic and we could spend hours talking about it today, but we hope to really focus in on a few key areas here in New Mexico that we'll zero in on. We're going to put a slide up here in just a second of all of our speakers. so you can learn a little bit about who our speakers are, where they work. I'll let that up so you can have a second chance to read that. So thank you everyone for joining us today on this important topic. So let's get the conversation started with Francesca. Francesca, the American Heart Association set a goal to advance cardiovascular health equity for all. So including removing those barriers for those that don't have health equity. My first question is really two parts. So one, set the stage, it's why this stake in the ground? Why health equity? And then secondly, as a big overview, what is the American Heart Association doing to address some of those barriers?
Yes, hello, Maggie. Thank you for that introduction. And again, Francesca Martinez, National Health Equity Program Manager in the Office of Health Equity out of our American Heart Association National Center. My pronouns are she, her, hers, and I'm joining you virtually from Dallas, Texas, the indigenous lands of the Kickapoo people. And, first, I also want to thank you, everyone, for joining us today. We know schedules are busy, so thank you for taking the time to join us today. Thank you, Marcia, for that wonderful introduction. And thank you to all the leaders who helped really move this conversation forward. And a big thank you to U.S. U.S. Eagle Federal Credit Union for supporting this event. We are so honored to have such a great partner along with us on this journey. As Sherry mentioned, our mission is to be a relentless force for longer, healthier lives. But we know that not all have that opportunity for good health, right? We, as the American Heart Association, are actually be celebrating our centennial in 2024. And although we have made tremendous strides in patient care and ensuring that those who have a cardiac or stroke incident survive, the actual incidences of these events keep increasing. We saw this trend in about 2013 and 2014 and began to really ask ourselves why. And so we convened the best clinicians and scientists and public health leaders to really help us understand why. And actually in 2015, we published one of our first statements on social determinants of health that, along with other research from the World Health Organization, Robert Wood Johnson Foundation, and other organizations, really gave us insight into what many thought, and that is those factors that we are born, grown, live, work, and play that impact our health even more than in the clinical environment. We were able to see that 10 to 20% of a person's health is modifiable in a clinic and healthcare setting, but the other 80 to 90% are outside of that clinical setting, right? Those factors we now know are called the social determinants of health. And for some, they were adverse, right? They weren't optimal. We realized that not everyone had that same opportunity and access outside of the clinical space. So then in 2016, we convened our first health equity task force that released their report on how AHA could really advance utilizing our brand, utilizing the science, utilizing our volunteer leadership to really address health equity. And from that report, we actually created the Office of Health Equity and really began to work to embed health equity in all of our work. And during that time, we began to see reports on life expectancy that further amplified how communities and factors impact health. Research has shown that even within the same city, right, several miles can yield a higher or lower life expectancy rate. Why? That could be access to healthy food, safer streets, cleaner air, health services, transportation, or even access to jobs can all contribute to an individual's and community's health. We're going to have some amazing panelists a little bit later who are going to talk a little bit more about how that impacts the health of New Mexico. But for our organization, that shouldn't be the case. And although we're not experts in transportation, education, economics, or the other factors, we do have science. right? And so we're grounded in science that states that when we provide all individuals and communities the opportunity, the big opportunity to access those clean jobs, to access clean air, safe schools, safe streets, we can improve health outcomes. And in the fall of 2019, I know I'm giving you a little bit of a history, but this helps really set the stage as to our stake in the ground. So in the fall of 2019, we actually released our 2030 impact goal. And that goal actually was to improve life expectancy rates. But then we know what happened, because then in February and March of 2020, and the COVID-19 pandemic exposed even more severe inequities within our communities and even around the world. And in addition, the unrest and injustices exposed with the murder of George Floyd awakened so many. And so our volunteer leadership, again, ramped up a discussion that started in 2018. And in 2020, we released our presidential advisory call to action, Structural Racism as a Fundamental Driver of Health Disparities, which states that structural racism is a system in which public policies, institutional practices, cultural representations, and other norms work in various, often reinforcing ways to perpetuate racial group inequity. We also call that structural racism is a current and pervasive problem. It's influenced by history, but it's not merely an issue of the past. It's experienced and produces adverse effects, whether it's blatant or perceived by others. And the burden of mitigating the impact of structural racism on economic, social, and health inequities is a shared responsibility. So it is all our responsibility to look at those systems and structures that exist within the ecosystems and address that. And from that advisory, we put together our 2024 impact goal that explicitly states that we're going to be champions for health equity. We will identify and remove those barriers that will help inhibit any opportunity for a full and healthy life. So then what does that mean? So in 2024, the 2024 impact goal was set out and released. And then we set 10 bold actions to address those barriers, right? We call them our 10 commitments. And these commitments are what we as an organization on the large macro level and also on the local level are taking to remove barriers to health equity in all areas of our work, including research, community engagement, advocacy, and more. And the sweeping approach really boils down to 3 focus areas. Social factors. Many people face health problems because of adverse social determinants of health, right? How can we help impact so that we can reverse those adverse effects, right? We also know that rural health is very important. People in rural America face increased health risks, often because they live in remote areas. They suffer from higher death rates from heart disease and stroke, lower life expectancy, and higher maternal mortality. So we've got to focus on our rural areas. And then again, structural racism. We know that there are public policies, institutional practices, cultural representations, and norms that perpetuate racial inequity. And so we know that this is a significant driver of health disparities. And so we've got to address those systems, but we know we can't do it alone, right? We are one organization. And so that is why it is so important we're having this conversation today, because we want to engage you in New Mexico in our work, right? We cannot do this alone. We've got to do it collectively. And so Maggie, there's so much more we can dive into, and we'll dive into a little bit more of one of those commitments a little bit later. But hopefully that sets the stage for why our organization is really focused on health equity and why it is imperative to come together with like-minded organizations like each one of the organizations you represent, also volunteer leaders, and all in our communities to address and bring forth solutions.
That's amazing. What a great way to set the stage and to frame today's conversation. Thank you for that. I think another part of the conversation is really talking about the differences between equity and equality and knowing the differences between the two. So Deb, I'm going to ask you to step in and help us understand the differences between the two.
Thanks, Maggie, and thanks, Francesca, for leading us off with such an inspiring discussion of why we're here today. And, to me, visuals help a lot sometimes. So I want you all to picture there's a baseball field and there's an exciting baseball team playing, and it's surrounded by a wooden fence, and there's 3 kids who just really want to see their favorite baseball players. And so they go up to the fence and they find the lowest spot in the fence. And the first kid, he's tall enough, he can see over. And then there's the middle kid, and they can't quite see over. And then there's this really short kid. And so equality means you take 3 boxes that are exactly the same size and you put each kid on a box because you gave everybody a box to try to help them up. Well, now the taller kid can see and the middle kid can see and the short kid still can't see. You got to see where everybody's coming from and that they're all not starting from the same place. So equity means you give the tall kid who can already see over the fence no box. They don't need one. They have their access. The middle kid gets 1 box and the short kid gets 2 boxes because now everybody can see over the fence. And in my ideal world, what you really do is you take down the wooden fence and you put up a chain link fence because now you have completely removed the inequities. And to me, it's so important to understand that when you say something like, well, why can't they pull themselves up by their bootstraps like I did? Not everybody owns a pair of boots. You got to look at where they come from, and that's what brings equity into the equation.
That's terrific. That's a great visual to see. And I'm right with you on let's put the chain link fence up. And that's what we're talking about is removing these barriers altogether. Thank you for that. So Francisco, you work in the field in the capacity between academic health centers and the community. So you see firsthand what's going on out there in New Mexico. Can you share with us what you see, how New Mexico is doing with our health equity efforts?
Absolutely. Good morning, everyone. Thank you, Maggie. Buenos días a todos. For me, it's an honor and privilege to be here with you. New Mexico, wow. If we compare our state to the rest of the nation, it's a very unique state because we're a very poor state financially, but we're a very rich state in terms of our culture, in terms of our history, in terms of the languages. We're a multilingual state. So historically, New Mexico, even though if we look at child well-being, we're usually at the bottom. With respect to issues like equity, health equity, social justice, we're at the top. New Mexico has been, because of our diverse population and the challenges that we have had, New Mexico has been addressing these issues for a long, long time. And just to give you an idea, and I would like to invite our participants, if I miss any group, because it's always hard when you start naming some of the groups, right? Because there's a lot of great things that are happening in New Mexico, very progressive, very out there in terms of thinking and looking at inclusion, diversity, right, and equity. So just to give you an idea, in 2006, globally, the Social Medicine Consortium, which is a collective that's working around the world, came to New Mexico, Gallup, New Mexico, in 2016. And that's when, through the American Public Health Association, Dr. Camaro Jones was the president, and that's where she declared structural racism a public health crisis. Thank you, Francesca, for pointing out all those points in terms of, historically what we have seen and what has happened. So there's that connection to New Mexico. And then in terms of looking at working with our population, right? There's a lot of American Heart Association. Thank you so much for taking this lead and US Eagle as a financial institution for really investing in really on having this type of sensitive, important conversation that we should all be talking about, and not only talking about it, but how do we create action around this, right? So that we could really create social change, systemic change. At the national level, we also have a partnership. It's the Community Partnership for Health Equity. And we are part of a consortium of different cities, the Bronx, all the way from the Bronx in New York to Oakland in California. So from the east to the west, New Mexico and Navajo Nation, Albuquerque and Navajo Nation are part of this initiative to really promote health equity at the local level. The New Mexico Public Health Institute, if we talk about the statewide, the New Mexico Public Health Association, they're having these conversations on a weekly basis to really address health equity. In Navajo Nation, one of the New Mexico Northwest Quadrant, they have a CARS, and CARS stands for a campaign against racism. So they're really working on how to have that conversation, how to address it with providers, how to address it with the community so that the community could really have a buy-in and can have, this participation in really looking at how do we create social change, systemic change. The city of Albuquerque, for example, also has their Office of Equity and Inclusion, where they're very committed to looking at how do we create social change. The New Mexico Department of Health with their vaccine equity, through COVID. Francesca, you also highlighted, how COVID really brought to light a lot of the inequities, a lot of the disparities that exist. And New Mexico is really taking action by really looking at how do we continue, looking at marginalized, looking at underserved, looking at disadvantaged populations so that we can really include them. The other thing that I want to highlight is that there's a lot of initiatives and a lot of work around language. So now we're seeing a lot of information out there, not only in English, but also in Spanish, in our Native American languages. New Mexico has 9 Native American languages, and how we're really customizing messaging to the people, with the people, so that we could really create change.
Thank you. That was great. And I want to remind everybody, if you have questions, because we're moving along pretty quickly, so please add those questions to the chat, and there'll be a Q&A session at the end. We'll try to get to as many as we can. But thank you, Francisco, for that. I appreciate it. And it's good to see what's happening across our state and how we're participating across the country too. That's really encouraging. It's some good stuff. So I'm going to go back to Francesca. You spoke earlier about some ways that the American Heart Association is identifying removing barriers of the health equity. So recently, I know the American Heart Association CEO Roundtable shared the Driving Health Equity in the Workplace report. And that's a way that helps organizations manage their health equity journey. And for us as business people, what we can do in our workplaces. So would you talk a little bit about the timing of that, the critical role that workplaces play? You alluded to that earlier. And then how we can participate in dismantling those practices that maybe we're contributing to the inequities in ways we haven't even realized yet.
That's a great question. Thank you, Maggie. And then again, thank you, Francisco, for just highlighting what the great work that is happening in New Mexico. As I mentioned, one of our 10 commitments, our leadership collaborated with our CEO Roundtable to architect a roadmap, a framework, and tools for employers to identify and really dismantle practices and policies in the workplace that contribute to structural racism and health inequities. And it was all based, again, on our Presidential Advisory on Structural Racism. And that CEO Roundtable is comprised of nearly 50 CEOs from major companies that are really committed to advancing employee health. And they assembled a writing group with experts in health and in equity and business to develop that Driving Health Equity in the Workplace resource and kind of roadmap. And again, one of our guiding values is to build powerful partnerships. And we know that in this journey, as I mentioned earlier, we cannot do it alone, right? To achieve health equity and be champions for health equity, we are not the only person out there. We're not the only organization out there. So partnering with companies like U.S. Eagle Federal Credit Union in each one of the other companies that we partner with in all of our other markets across the country is so important. And, I love the fact, a little sidebar, I love the fact that U.S. Eagle Federal Credit Union is partnering because we're a health organization. And so we have a financial institution and a health organization, but we know that finance and economic security has a tremendous impact on a person's health and a community's health. And so with innovative partners like U.S. Eagle Federal Credit Union, we are going to be able to work together to really address those inequities. So, but we know historically, unfortunately, inequity, discrimination, and bias, we know they have no place in the workplace, yet they do remain, right? And again, that's rooted in historical and present day policies and systems that may favor one group over another. And we know that these problems have proven to take a really heavy toll on the health and well-being of employees, organizations, and communities in which they are. And our aim is to really help end historical structures and workplace cultures that, again, advertently or inadvertently treat people inequitably based on race, based on ethnicity, based on gender, based on sexual orientation, age, ability, veteran status, or other factors. And we know, and as Marcia mentioned, research shows that promoting health equity can benefit employee health, productivity, and reduce those healthcare costs. So there's a business case as to why addressing equity and addressing those internal systems and structures can have a benefit. And in the report, actually, let me get to the report. So in the report, we provide 15 internal strategies that a company can adopt. We are all various companies of different sizes, different makeups. And so where are we? And we know that many companies took an inward look at where they are, especially in 2020. And so no matter where each company is starting, there are 15 ways, right, that a company can adopt. Whether an organization is well along on their journey or just getting started, they can rely on this comprehensive, very evidence-based strategies to really inform their internal policy and procedural changes and help evaluate that impact. Some include offering paid family leave and medical leave, ensuring pay equity, right? Providing a living wage, promoting health literacy and employee benefits literacy, right? Ensuring supplier diversity. How is your business spending the money it has? And are you providing all businesses the opportunity to bid or provide services, right? Those are some of the strategies that a company can employ. There are also 5 external strategies for health equity, because not only is a business its own organization, right, and its own ecosystem, but the business operates within a community ecosystem. So then how can that business also help advance equity in the community that they serve and where they're located? We know they have a unique role and opportunity to support a rational public dialogue on inequities and really elevate the impact and important discussion on societal investments to really address, again, those structural barriers to optimal health. You know, some of those strategies include advocating for comprehensive, understandable, and affordable health insurance coverage for all, right? Advocating for affordable housing. Where do your employees live? Do they have to commute more than an hour and a half, right, due to how housing costs? Advocating for high quality, accessible, and affordable early care and education for children, right? We know that childcare is an important factor on a family and a caregiver's life, and does impact their emotional and overall well-being. Advocating for culturally and linguistically appropriate services in the health system, and then also advocating for increased support of public health infrastructure. So we believe that partnering with businesses, and that each business has an opportunity to do things internally, right, to help create and change their culture from within, but then also impact the larger ecosystem and the communities in which they operate. And so, you know, these last 20 months have shown us that the direct connection that work and home play, right? Businesses now have the opportunity to help positively impact their employees' health, both the physical, mental, and social health.
This is a great way to frame that of our responsibilities as in the business world and the impact across our communities, and then communities touch communities and states and nations. And before you know it, we've really made some. So starting today with things like this conversation, I know US Eagle is really happy to help sponsor that. So Jeffrey, I wanted to ask you a question. So when the work that you do, you face the struggles of health equity for many New Mexicans. So can you tell us what you're seeing as the big struggles or divides or challenges that you see from the employee or the individual's perspective? We talked about company responsibility, but share with us what it's like, what you're seeing in your work.
Of course. And, you know, I'm going to use a few anecdotes, but I think they really tie in clearly here. And Francesca actually teed it up kind of perfectly, that when you look at it and when we look outward and see people that we can get connected to health insurance coverage, which has a lot of downstream positive impacts of getting people in sooner, getting them to primary care, you know, XYZ, that we don't just run into a lack of knowledge around health insurance. We run into a series of things. And really, we not only as an organization trying to address the health inequities in New Mexico have to work on that education and that culturally and linguistically sensitive education around what we do, but we also need to understand we exist as one node, or maybe a few nodes, within a social ecology around people where a lot of the nodes have had health inequities. And we can't fix all those, but being a source of education and support on where support can come from in those different nodes is critically important. And the anecdote around this is we, early on in the pandemic, we're trying to connect people to coverage for the obvious reasons. And we're working a bit in Gallup and talking to some people who are having challenges in Gallup and just having a community conversation. And the thing we heard almost monolithically from them was, yeah, of course I'd love to sign up, but realistically, I got diagnosed with COVID. I'm in a place that's not my home to be safe. I can't get a nurse here. I have all of these things. So I'm not actually worried about the cost of coverage. I'm worried about just getting coverage. And it's covered right now because of, you know, especially those early days when they were covering quite a bit. That's one challenge, but there's many. And the more rural you get, the more challenging it is. Now, to Francisco's point, it is a wonderful thing because New Mexico is so diverse. We are a very rural state, which is a wonderful thing. I mean, I grew up myself rural New Mexico and thankful for it. We are also a very diverse state, and we talk to our peer state-based exchanges. And this is kind of a hot button issue and has been for a few years, how we keep, you know, moving the needle on health equity. But the thing I always remind them is anything they're facing, we face to a higher degree because of how diverse we are here, that as a majority minority state and as, you know, such a diverse state with so many languages and so many cultures and so many locations, you know, geographically, that everything we do really needs to have this breadth through it. And one thing we've also noticed is that equity is a critically important thing to address and work through, but one also needs to consider empowerment. And that can be a little bit more amorphous, if you will, in the sense that empowerment comes from within. And to use another anecdote here, Medicaid tends to be a pretty good deal for public assistance. If you make a small enough amount of money, you can qualify for, you know, Medicaid coverage. There's still 40,000 people in New Mexico who qualify for Medicaid coverage and just haven't taken it up. And so I think the existing structure in health insurance and even in equity with some of the conversations we've had in the past is if you build it, they will come. But that's not necessarily true. I mean, you have to build it culturally and linguistically appropriate. You have to make it accessible. You have to make it understandable. You have to have your champions in the community who understand this stuff and really look at all of those internodal dependencies and all of those internodal relationships to build not only the equity in the community, but really have the tools accessible to the individual and to the community to ensure that they are empowered as they want to operate and support their own health.
It's a great perspective of, especially in New Mexico with such a wide geographic area. I mean, we're just Rhode Island. How many Rhode Islands are in here? It's just, it was such a big state to cover with many needs. So thank you for that, Jeffrey. Deb, I have a question for you. So as an attorney that heads up your firm's health law center and an employer, can you tell us, an employer who obviously, you know, values health equity in the workplace, will you share with us thoughts on what are some of the most important things that an employer can do now and maybe in the future to support health equity in their organizations?
Thanks, Maggie. That's a great question. And I want to go back to some of the things Marcia said early on in her introductory remarks. If you have a culture in the firm of, we know that healthy employees are better for us and it's better for them and it's better for us. So we want to set that up. You know, let's have employers have more of that US Eagle credit union mindset. And there are so many things you can do. And I go back to some of the things that Francesca said about institutional policies and procedures in mental health and social health. What kinds of things can you do? You can make everybody on your team feel like a part of the team. Don't create a hierarchy where the lawyers in the firm, because they're all stressed out because they have to practice law, get to have the masseuse come in and do chair massages once a week. Recognize that everybody in the firm has stress from wherever they're coming from. Give them the same opportunities. Put together a wellness program that you get input from your employees on. And The ones that want to walk, set up walking groups and set up specific times and give them time away from their desk to go do their walks once a day or whatever, and create those little spaces of time. The ones who want to do yoga, set something up like that. When you recognize that something like COVID has caused all kinds of changes in everybody's life, set up mental health sessions for everybody, not just pieces, and gear it to where everybody's coming from and address the different issues that different people have because of whatever. You've got older people who don't have kids at home anymore, so they're not worried about how to make school work when all of a sudden, oh my gosh, we have to go remote because of some cyber attack at APS. Deal with everybody where they come from and create an environment where everybody on the team matters and feels like they matter. And you can do practical things like when you're looking at your benefits every year and you're going through what health insurance are we going to offer to our employees next year. Don't just go out for bids and pick the smallest number. Take a look at what the impact of that smallest number has on your employees. And if you take a look and you go, you know what, we could change to this and we could save X $1,000s a year, but you know what? That's going to remove certain people from their doctors and you're going to make them change their doctors. So let's not do that. That's that. Think of those kinds of things and not just the bottom line. I think it's just important to take a look at all of that and just be kind. One of the things that I love so much about our firm is we have a top-down policy. Be kind to each other. Everybody here matters. Everybody is diverse. Everybody comes from a separate place, and we all be kind to each other, and nothing less will be tolerated. And that's a very important point, I think.
Thank you for that. I like that approach because some things are very reachable and can be done in very low cost. And then some bigger strategic thinking on, really being thoughtful on our benefits and what we offer and how they're being used and what's being utilized to make decisions off of that data makes sense. And it's talk about the right thing to do. So I'm going to talk to Jeffrey. So thank you for that, Deb. Jeffrey, so tell us, we know that creating more equitable workplace is the right thing to do. We've established that today. But can you share with us some more of the benefits of promoting health equity in the workplace or in the greater community for that matter?
Absolutely. So we here at BWell&M are very proud to have a very diverse staff. We really have always driven towards that. And as part of that, though, you have to celebrate that diversity. It's important as an organization, not just to, make sure that you're hiring folks that resemble your state around you, but it is important to do that, but also really to take their build your organization sensitive to what that diversity looks like and ensure that, it matches both internally and externally. So health equity in that way pays out in, multiple very positive ways. First and foremost, if your employees feel supported and embraced for their background and who they are and what they bring to the organization, they not only are better employees and healthier employees because of the mental health aspect of this, but they're also then going out and serving the communities that you've hired them to serve and doing it in a way that is emblematic of the community itself. That really your employees are your channel to the mission that you've got. And we have, some folks who I've reiterated a handful of times that, when you're here, you're the community champion. And when you're out there, you're our champion. And you're that ultimate translator of what we need to be and what we need to do. But also bringing that back and helping us evolve so that we can be that and translating it into that community so they understand, where we can fit in and help them. But then ultimately, just looking at the health itself and really the health aspect of this, as your employees are supported and healthy, they're more productive, they're happier, they embrace their work more. And for BWell&M, we've had a tough stretch the past few months and really the past couple of years, changing a lot of what we do to address and try and meet the moment with the pandemic. That we've seen the pandemic's impacts on especially communities of color and how they have been disproportionately impacted, and how, you know, we can be an agent of change in that, be an agent of mitigation of that, and really turn the tide on these things. And you can't do that unless you're really embracing what all of this means and how you can be that agent of change around it. And if your employees feel that they're empowered in that mission, then they'll be able to give you the feedback and give your organization feedback on what they need to be to pick it up and run with it. And when you hit those hard times and you hit those times that challenge you as an organization, which we all see, they are better prepared to really address it, and address it fundamentally with transparency and with caring. And if you're doing that, then you weather those times and you get up off the ropes and you really, you know, help your community with everything you've learned through all of it.
I think you're spot on with that transparency piece, and we meet each other where we are and really seeing people. That's important. So thank you for that, Jeffrey. We know health equity is good for individuals. We know it's good for businesses and the community. So thank you for highlighting all of those. And I know Sherry is going to share the resources we talked about today for those of us that are interested in learning more about what we can do in our own workplaces, and to continue that conversation internally for ourselves. So back to Francisco. I'm being very careful with the two names. In your opening comment, you spoke about the uniqueness of New Mexico, and we've talked about that a few times, and the good work that we're doing. So as our panelists all shared their many organizations and focused on our work of health equity and the resources that are available to work. However, there's still quite a bit of work to do. And we want to know a little bit more about, share with us what your thoughts are on how we can work alongside with American Heart Association and address the things happening here in New Mexico to make it a more equitable and healthy state.
Sure, thank you, Maggie. And I want to thank all my fellow panelists for sharing all the important points and highlighting the things that are happening that are good, and how do we convert that to action, right? And when we think about health equity, health encompasses education, transportation, food, housing, right? All the different issues, the social forces that affect the individual, the family, the community, our society. So in thinking of that broad spectrum, it's also nice to see that our participants, you know, we have community representatives, we have community schools representatives with us, we have administrators from health plans with us, we have public health practitioners. So like Jeffrey said, as social agents of change, what can we do? And here I'm going to throw 5 Ps that we should consider, right? And these 5 Ps, whether, you know, it applies to every single one of us that really want to see something different for New Mexico, something that is going to promote health equity and create a healthy state for us, right? Where people are healthy and thriving, reaching their maximum potential. So the 5 Ps are these. Proposals. Whenever you submit a proposal as an organization, as a school, as a community representative within a health structure, think, so that's the first P, think of the following: people. How is it going to benefit the population, right? So the work that I'm doing, the idea that I'm proposing, the challenge that I'm kind of presenting, how is it going to benefit the population? That's the second P. The third P is practices. The work that we're doing, and through our practice, what are we doing different? What are we doing that's going to benefit, that's going to include people, that's going to bring voices to the table? So think of our practices. The fourth P is policies. Through the work that we're doing, through the practice that we're, you know, how we're engaging communities, how are we going to affect policies? There are some policies that are pretty old and they need to be reviewed and they need to be updated because they don't apply to the lifestyle now, right? The way life is right now with social media and technology and how things have changed. Or there needs to be a new policy that does not exist. How can we create new policies? And then the fifth policy has to do with peace. So the definition of peace is a state of tranquility. Imagine if every single one of us were in a state of peace and tranquility where we wouldn't have to worry about our health. We wouldn't have to worry about our finances. We wouldn't have to worry about our kids getting, decent, honorable jobs or scholarships, right? So how do we promote peace? Again, the 5 P's is our proposals, the people, our practice, policies, and peace for our communities and our society. So I want to challenge every single one of us in this important conversation to think, as an individual, what can I do to promote health equity? So think, as a person, what can I do within my organization, within my institution, within my community to really promote health equity? The second thing is policies. How can we review collectively some of the policies that exist? Right now, we're about to end the session, right? The legislative session. What policies are being presented that are really going to help our people? Language access, that's, a bill that's being presented, and how that's going to impact, every single sector: education, health, social, right? And then the third thing is, as a collective, what can we do for our communities, right? And working with our institutions, how can we make the institutions or the groups or the organizations that we represent accountable to really meet the needs, close the gaps, identify, what can we do different? But don't forget, let's take a strength-based perspective approach where we really look at the assets that our communities already have, right? Again, just in my opening statement about the uniqueness of New Mexico has a lot of potential because of our population, right? The fact that many people here are bilingual, multilingual, multicultural, right? How do we bring those assets to really address some of these deficiencies, right? And bring people with that kind of local wisdom and local expertise for this social and systemic change. Thank you.
Thank you for that. That's a great call to action for all of us. Thank you, Francisca. So I know there's some Q&A, so if you haven't put your questions in there in the chat yet, please do so. And we'll get to those topics here in just a minute. And I just want to say thank you, everyone. This was wonderful. Thank you so much to our presenters for sharing with us today. And Sherry, I'll turn this back over to you, but thank you all. It's a great conversation.
Thank you. I have to echo your thanks to Maggie. Thank you to everyone. This has been such a compelling and really deep dive into what we know can be a long conversation. We're hoping to be able to do more of this. I just want to thank you all for attending, and thank you again to U.S. Eagle Federal Credit Union for being the sponsor and the catalyst for getting this on the table for all of us. And as we said before, we hope to keep being able to do more of these. Health equity, it's a journey, and each of us, each individual and organization are at different places on that journey. And I think that what I really heard out of this today too, and Francisco, thank you for sharing the 4 Ps. But let's come back at this. Let's keep working on this with a strength approach, and let's utilize our assets. I heard so many assets today that I wasn't aware of here in New Mexico, and let's continue to be a leader in the work of working toward health equity. So I think we have to, when we leave here, let's think about how each of us can apply what we learned today to make a difference in our own networks, maybe in our own personal lives, professional lives, and our networks. Think about what Francisco said, individual. What can I do today? What can I do in my organization? And then what kind of policy can we help advocate and get engaged in? And then of course, the last one of peace and tranquility. We want to wish all of you peace and tranquility. I think with that, we'd love to hear more about your efforts. You can reach, if we can put my email in the chat box, then reach out and let us know if there's other topics, or if you'd like to take a deep dive in a particular area, or hear more from our I call them conversationalists, not panelists. It was great conversation today. So thank you all very, very much. And on behalf of American Heart Association. I thank the people behind the scenes that really have kept this going today so that we're able to watch each other and to have these stations. But we have Cheryl Wilkeson, our Community Impact Director, behind the scenes. We have Kim Haddock and Jennifer Bell from the American Heart Administrative and Technology team behind us. So thank you, everyone. And I hope you have a great day.